16:37. You all have an agenda and then you all receive minutes. So our first, first, are there any introductions and general announcements? I guess we have a new face at the table. Yeah.
I guess I can't sneak in here on the scene. Hi, I'm Elizabeth Butcher. I work in DEI. I'm the staff development and ADA manager. So we have many interests in what you guys do here, but mostly just in a learning mode, and glad to be here. So thanks for having me.
And she's part of your.
So she's part of Monroe County Office of Diversity, Equity, and Inclusion. So
yeah.
She's been learning about all kinds of different departments
Yeah.
within the county, and I mentioned that we have a board of health and it's open to the public, and she wanted to.
Oh yeah, I just
So you're
literally
public-
saw your
public
meeting
member
schedule.
here
I'm a
today.
public member. Yes, I guess that's my
Yes.
capacity. Thank you for having me. Yeah.
Internal, external, public member. Yes, thank you.
Yeah.
Any other general announcements or conversations? Check out the scenery here.
There we go, that's even better. The furthest away possible. All right, so I guess our first order of business is the approval of the minutes. So you all received the February 3rd minutes. Thank you for putting those together, Megan. Any comments? I think we asked for via email, but any changes? So if there's no changes, a motion to approve the minutes. Motion over here. And second. Over here. Emma.
Yes.
My mind. Motion from Emma, second to. I know. All right, so all in favor of approving the minutes? Aye. And opposed? Abstaining? All right, minutes have been approved. Thank you very much. All right, and that takes us quickly to our commission report. So, Marty.
Welcome, everyone. So we spoke for quite some time at the last meeting about the concerns around federal funding and the freeze, and is money coming and is it not? I don't have any concrete updates to share about actually getting the funding. Certainly our county administration and the county executive has asked all of the department heads for detailed information about what kind of funding might be at risk, might be in jeopardy, and so we certainly shared lots of gory details about the $6.7 million that we stand to lose in a worst case scenario if all that federal funding was revoked. My understanding is they're taking all of that information from all of our different departments, and the New York State Association of Counties is advocating for them to happen through their channels. We have not heard anything from New York State about any of the pass-through money that goes from the Fed to them and then down to us. That's a whole nother separate large pot of money. But they don't have any concrete information either, so they have nothing to share with us or at the local health department level. So we are forging ahead. I'm being as transparent as I can with my staff. There has been a lot of anxiety and concerns about, positions that are fully grant funded. Am I going to be out of a job? And as far as I know, no. And we're going to continue to do the good work that my team does until we hear otherwise. But it's been challenging to hear and receive that stress. I can't imagine what it is for some of our federal employee colleagues as well. But when I have more information, I will certainly share it with all of you. Some positive news. Our Office of the Medical Examiner has a joint forensic pathology fellowship program with the U of R's, URMC's pathology department. And so we train folks they have their regular pathology residency programs, and then folks who are interested in forensic pathology, they do co-training with our office. And so that department has received reaccreditation, which is good news. So we can continue to try to train more forensic pathologists who could then step into the roles of medical examiners. They have one applicant for the next year's cycle, and I believe I've shared with this board before, we are not, as a country, all residency programs are just not graduating enough medical examiners to fill all the openings in the US, and certainly in the middle of cold March. Can't blame folks for choosing to go practice in Miami or other bigger city. We all know what a great place this is to practice and live, but sometimes recruiting others who are not from the area can be challenging, but doing our part. And so unfortunately, the reaccreditation is only annual, which feels like a lot of work to do every year. But they've achieved it, and so they're holding on to every positive news story at the moment. Another positive staffing point is that we have offered and had accepted an executive secretary position for my department. So that will be a huge relief when Terry Lynn Forney was Department of Public Health staff member before, went to a different county position, and will be back with even more skills than she left with. So she'll be starting March 17th, which will be a huge relief off of me. And we have an interview this week with viable candidates for the deputy commissioner position. So I am very hopeful that that person will actually end up being a good fit. And as soon as we have good news about that, I will share that with this team as well.
What was Terry Lynn's last name?
Forney, Forney. Anyway, she's lovely. She's gonna do really, really great. She had worked in our administrative office in a different capacity before, so she's very familiar with the processes and so you'll be able to hit the ground running. I recently had the opportunity to present to a number of school district, K-12 school district officials and administration. I shared that with you all yet? Very good. Okay. We were.
Since we're planning on having the meeting.
Okay, so it happened. I got to talk to the school district officials. Mostly, we build it as a reintroduction to the Department of Public Health and how we can collaborate with school districts, what we can do for them, and what we would like to ask them to continue to do with us. Because we've heard from the head of BOCES 1, Tom Putnam, I think he's BOCES 1, that a bunch of West Side school districts are considering not participating in the Youth Behavioral Risk Survey. As you all may recall, the YRBS is the only anonymous survey of students across all the school districts where we ask about all kinds of behaviors. So how many hours of sleep and how much time do you spend screen time, and you wear your seatbelts, and are you experimenting with smoking or vaping, or what kind of sexual activity, are you using any kind of protection, are you being bullied, all the ACEs and like trauma experiences. And so those data are so important for, school districts can certainly use it to feed into their social emotional learning curricula or health curricula, but we've had 20 years worth of data where we can track trends, and we were just talking before the meeting started about expecting to receive some dual settlement funding to do work around vaping, and how are we going to find out where that money would be best deployed if we don't have this data source. So I presented about all the different things that we do. So immunizations to try to keep kids from getting excluded from school. We invited all the school districts to become EI evaluators, so early intervention. The more that schools do to evaluate students, and then of course they would be reimbursed through our department through federal funding streams. The fewer of those kids need to be assessed by private speech and occupational and physical therapists, and that opens up more bandwidth to just serve kids' needs. And certainly we talked about our addiction services team and providing Narcan training and collaborating with schools around prevention work. But we really did strongly push and encourage continued participation from all the school districts in the YRBS. There were some community groups that came in and talked about using that funding. Uplift Irondequoit was one of them. They do a lot of work out in the community to support youth and families that are struggling with substance use disorders. We had some representatives from the Greece School District, where they have a community schools, and talking about how they use some of that information to just figure out how to support families, not even specifically around academics. But I guess the proof will be in the pudding when we start planning in kind of end of this month into next month is when we really kick off the planning with the school districts, because we offer the YRBS every 2 years, And so we're planning now to deploy it in fall of 2026 and then 26, 27 school year, and then crunch the numbers and give school districts back their data and do a summary report for the entire county in the kind of spring semester of 26, 27, so that would be 2027, thank you.
So how many school districts participated?
Oh, I'd have to ask Jill.
I'm just curious.
I don't have that exact number, I don't remember.
Most.
Good question, it felt like many, the room was quite full, no, seriously.
Yeah.
Just there. That is an excellent question, I can certainly get that.
Yeah, I was curious if like the folks from the west side participated.
Showed up, yeah.
And then what's your outreach or communication with charters?
As a team, because we certainly want our children to participate. But that's a question, I'm not sure.
Was there explanation, rationale provided by the West districts that were reluctant or expressing?
So the concern was that it's another survey to have to do. Many school districts already run things like Panorama, and I don't know if you can fill in the names of other surveys that they do of their students about a number of different things. And so those surveys are tied to a student's ID number. And so they use that to track like kids that disclose, I don't know, concerns can be then referred to the counselor, or certainly they track students' academic progress with math and all the other things that they're supposed to be learning. And so there was just a question of one more thing to have to do. I'm sure it would feel like just one more thing if schools were not using the YRBS data the way like Greece School District talked about how they use it. There's so many other reasons that community members and the anonymity portion also is super important, right? Anybody, much less young people, when we ask about potentially taboo subjects or topics that am I gonna get in trouble? Is this information gonna get back to my parents about smoking, sex, drugs, rock and roll, all of those topics, it changes what people are willing to disclose. So we made that case, I shared that fact, and so I'm hopeful that we'll be able to motivate folks to continue to participate with us. We're gonna run the YRBS with whichever school districts are willing to work with us, and we make extra efforts to work with the Rochester City School District because there's such a population concentration there. And we all know there's higher needs in all the social determinants of health and education and life in that geographic area. But we are hopeful. So that went well, and hopefully it will have the intended effect.
And the schools didn't come to you and say, we're out, you just heard through the grapevine.
No, so my understanding is that the BOCES, the Boards of Cooperative Education, what is this? I forget what the S stands for. Their BOCES 1 and BOCES 2 kind of serve as some sort of financial way to support schools on the east side and the west side, and so it was the director of the West Side BOCES that told us that in their conversations, he's been hearing this from some staff, there has been turnover in leadership, folks might not have been present in their, I don't know, VP or principal position when it was last run, so they might not have had the opportunity to use the data, or, maybe they're just hearing from folks that are not in favor of running another survey.
And it's not that they're concerned about the LGBTQ questions and all that.
No, I mean, every year that we run it, so on the 2-year cycle, we do have discussions with school leadership about what questions are going to be asked. And every year we talk about how we don't want to keep adding questions because it gets longer and longer. And every year we talk about, well, should we remove this, should we do that? And always make an argument for keeping most, if not all, of the questions. So it hasn't gotten much longer in recent years. We have added questions as new things come up. So like vaping, that wasn't a thing, and so but as soon as it was a thing, we started asking about it. So
Our students do it during their gym class.
many do it during gym class, or where they're not taking reading, they're not taking math time to do this. Yeah. But hopefully we will get good participation. And I will find out about our charter committee, so there's one question we just haven't had the bandwidth to ask. So one other thing I'd like to make you all aware, this will be the 35th year anniversary for Starlight Pediatrics, which is the clinic that our department runs that provides holistic, trauma-informed primary medical care to children involved in the foster care system. And I can't think of a more vulnerable population. So the team is planning some kind of a celebration event. I'll give you the date of the afternoon of Wednesday, May 16th. I don't have times, I don't have like details, maybe book some time for the county executive to come and probably read a proclamation and certainly share some of the history of how Starlight came to be. We are working to invite some of those founding providers. Moira Szilagyi is a pediatrician who I think is now a past president of the American Academy of Pediatrics, so just has done tremendous work. And so I think she's actually pretty interested in coming back for that. So as I get more details, we'll let you know. You would all certainly be more than welcome to come and kind of celebrate the fact that we have this resource for this population. To my knowledge, there are only 11 clinics in the entire country that cater specifically to children in foster care, and they have so many needs. Like they're kids, right? We're doing well visits and sports physicals and all the just Ubers going around in the winter months, but also because of their ACEs and their trauma, they have a lot of behavioral health needs and mental health needs. And so they just need more time to build a trusting relationship with another stranger in their lives. And so I'm really glad that we can be that and we can maintain some level of consistency as children move through the system, maybe go back to a biological family member, maybe bounce back into care to a different foster home. So I'm really proud that we get to do that work. It's hard. It can be quite painful to have to read what humans can do to our children, but it's really gratifying work as well when the kids can finally start to heal. So I think it's important work, and I'm happy to be able to highlight it and let the community know, like, hey, this is a thing that we have, and let folks know how to support. I'm a foster parent. Don't be scared of that commitment, or donations of clothing or other, hair products, especially for more textured hair. If you are picked up at school one day and dropped somewhere different, what if that family doesn't know how to do your hair? What does that do to, especially our young ladies' image of themselves? So there's a lot of ways that folks can support. So we'll get to highlight all of them.
That's exciting. Congratulations.
And so then my final update is that at our next meeting, I plan to have all the approvals and all the information to discuss the Cure Violence Global Assessment of how our department can contribute to anti-violence work. So hang in there. Don't forget what to talk about that. What questions? We don't have any cases of measles yet in Monroe County.
Here. Common practice.
No,
Is there any concern about vaccinations or anything that you've heard?
pretty good. Vaccination rate's still in Monroe County, but we've had a huge outbreak in Texas. They finally had their first pediatric death from a completely vaccine preventable illness last week.
Is that person? That's not vaccine.
And so it doesn't have to happen. We have the technology to protect children and our seniors and everyone. The measles vaccine is super effective. I can't remember the exact amount, but it's upwards of 95%, 97, thank you, Megan, 97% effective in protecting people against getting measles. People don't have to contract this disease and certainly don't have to die of it anymore, but it's important to get vaccinated, and it's also important to get vaccinated on the regular schedule. Some folks are not completely opposed to vaccines, but they don't want their kid to get 7 different jabs in one visit. And, our immune systems are designed to fight a million things that we're exposed to every day. Kids and babies crawling around on the floor, putting everything possible in their mouth. Their immune systems are already protecting them against lots of different things. Yes, we give vaccines and we might boost the immune response with something called an adjuvant to just make sure that they're really, really gonna be protected, but you're not gonna overload a child's immune system by accepting the routine, regular schedule that we've been using for decades. So we have, I don't know, 50, 60 years worth of safety data regarding the measles vaccine, and it's never been safer than it is today.
So I have a friend who's getting a booster because they're old like me. Apparently there's a window in which you're supposed to get a booster. Is that true or?
I will go look that up before I give you an answer.
Yeah, no, it was the whole, you know, before this date you're fine and after this date you're fine, but if you're in the 10-year span of when I would have been a kid, that there's a recommendation for a booster. Yeah.
We will
You're
make
too
sure.
young.
You're
You're
good,
good,
you're
you're good.
I will make sure,
Yeah,
look into that and
seriously.
check, and I will certainly put that information out. Certainly if you're someone who's immunocompromised.
Yeah.
Who's, had any reason to, I don't know, get chemotherapy or something like that, definitely talk to your provider about getting a booster when it's safe to do so. But most of us are gonna be.
Yeah.
And
is COVID doing?
it's been a bad year for upper respiratory infections. We've had just a lot of cases, a lot of flu. COVID is behaving more like a normal upper respiratory infection. It's not as virulent because it's been around, and so folks have either been exposed or gotten the vaccines. And so we have seen a lot of morbidity as well. And so the hospitals have been over capacity, I want to say, since October of last year. And so it's been a lot of illness, and I'd have to go back and read up on how good a match it's been this year, the strain that's circulating
Right.
versus the vaccine that we had available. It's been all high burden.
I wonder when, in the vein of finding ways we can be helpful, when it gets to the point of administering the interest behavior survey, or whether it's messaging around vaccines or messaging around this is okay, do it. Like if there's a way we could spread that word amongst our networks, I don't know if that would help or not. Like I'm not on the west side at all, so that's not a thing, but certainly could help my circle. I don't know what that mechanism is, but in the vein of trying to be more helpful and more active, it seems like.
Yeah, I'd have to go back and talk to, so Tom Putnam is the head of Policy One, and I don't recall whether the decision gets to be made at the entire district or at the school principal level. Because if it's the school principals, it's a lot more legwork
Yeah.
to do. And you're right, it would be much more impactful to hear from folks that are within each of those districts or those school buildings. Let me look into that, because I appreciate the interest to want to help.
I mean, I think we just wanna
ensure.
do whatever to boost.
I think Tom's.
Okay.
In terms of strong numbers and cases, mid-February, they were the highest. And now they're like down a little bit, so EDs and so it gives you a little bit of perspective of like we're not starting to go the other way.
We were like 200 beds over.
We were terrible.
200 people, and they're just sitting in the hall.
They
Yeah.
sit in the hallway.
Yeah.
They're getting good care, but they're not, obviously you can't be 200 beds over capacity very long.
Or are they doing that PR project to
Yeah.
right, to expand, right? A 200 bed, but 200 bed.
I mean, I don't.
Well, so part of the problem there is that we have a number of other seniors and
Yeah,
other
of
folks
course.
with dual diagnoses, so like maybe mental health diagnoses and some
Right.
other health thing that can't be placed in skilled nursing, long-term care, a nursing home. We don't have the beds available and they get to choose. I forget all the details because our department doesn't regulate nursing homes and those kinds of facilities. But that's a huge problem, is that people who could be discharged are sitting in a bed and there's nowhere to send them. So.
pushing on both sides of the.
Yeah.
I'm actually curious if there's anything you could share about the the new opioid group that kicked off in the last month or so, looking at the cases and reviewing them and stuff
The
like.
opioid fatality review
Yes.
committee, yes.
Thank you. I'm
Okay.
sorry.
No, that's fine. So, the opioid fatality review committee is a kind of a national practice where you get a multidisciplinary team of people to sit around the table and discuss one individual case of an opioid overdose. We had talked about doing that a number of years ago and just didn't have the bandwidth. And so when the county executive created the research strategy and development team, he asked them to look at two easy problems: the opioid epidemic and gun violence. And so they really took a deep dive, explored, and have been kind of taking the reins on putting this whole farm together. And so the governing board has been chosen, and we had our first meeting, and they are in the process of getting all the final details about how are we going to choose cases and what is the timeline of when the committee is actually going to meet. And the whole goal is to learn about, so our department already gets a lot of data about all the numbers at the population level, but how do we zoom in on one individual person's experience through looking at their medical charts, doing next of kin interviews, which takes a lot of concern and training. Like that's someone who's lost a loved one, preferably within a reasonably recent time frame so that you can take actionable steps. And so to learn which systems do we want to bolster? Are there gaps that can be highlighted and filled? What are things that actually work well and really support that further? So I'm part of the governing board. We have a number of our staff that have been invited to participate, and it's not something in my wheelhouse, so that's kind of what I know so far. And April, I don't know if you've heard anything further because you're on the governing board.
Sorry if that was premature, but I was excited about it and thought
No,
others
it's
might be
great.
interested in hearing.
Oh, thanks.
Taking that step.
Yeah.
There was such a thing. We have so many opioid deaths, it'll be interesting for you all to decide which ones that we're looking
Yeah,
at.
that is a question
Yeah.
that I haven't, I'm just not sure exactly how they plan to select cases.
Yeah.
You could certainly, there are community members who have already volunteered, like, hey, here's my child's name and their date of birth, and or my spouse or whomever, let's learn from their death.
Yeah.
Which is helpful, but that is a strong selection bias, right?
Right.
Who are the folks that are gonna know about it and then have the wherewithal to, or trust in the systems to volunteer that? And how do we make sure that we're selecting a diversity of cases so that we learn from a diversity of experiences? And so that's one of the questions that's still outstanding in my mind, but I know the RSD, the Research Strategy and Development team, has done a ton of work. They've traveled to Chicago. They've spoken to, Erie County has one, someone downstate has one already. And so they're learning from, the folks that are in the New York State context. And, some of those contexts are a little bit different when you talk about New York City or Erie County with regard to getting data from the medical examiner's office. We can't share that data under current New York State law. But there's still lots of learning that you can do and good that I think can come from it. So.
About process question related to, I'm happy to wait a month, but related to cure violence. So when it does come to this group, will there be opportunity for further advisement at that point, or is the assessment coming with recommendations, or how would we receive it next time?
They have made their recommendations. We have taken those recommendations and talked at length to community agencies that are already working in the kind of the violence prevention space. And so what I will be presenting is what we are planning to do. We certainly are happy to hear all of your input about that, but the choice of how we're going to proceed has been made based off of the information, their expertise, and then hearing from the agency.
Thank you.
So when you made two focus areas, opioids and violence, is the cure violence and this process part of his thing, or is he doing something else that maybe dovetails or not?
So it's, cure violence, what our Department of Public Health is doing.
Right.
Is planning to do in this space.
Yeah.
The research strategy and development team has been kind of doing their own assessment of what are other people doing in this area, and really they're, I think they're trying to keep track of who are the players, who's
Yeah.
doing what. I think that's what I know. Okay.
That's what I know.
That's what I know so far.
And I thought that was part of coming in to make that map of what's going on in our community. But I
So
maybe I heard
we,
that wrong.
no, we've had those, so our consultant through Cure Violence Global.
Yeah.
They took the data that we had available and have done their evaluation and assessment. They will be coming in to help us deploy the plan,
Oh,
so. I don't think that's what I shared.
yeah, no, but I'm excited for it too. So hopefully the plan fits into, we don't wanna work in silos, right? So what the research strategy is.
And we've been keeping each other, I mean, I've been sharing with them what we're planning and what we're
Yeah.
hearing and the data that we have access to that we can share.
Is that internal county team supposed to come up with a plan to address community violence? I mean, as far as I know.
I don't know
Or just like
exactly
research
what
it,
their
or-
charge is.
Okay. That's fair.
And you know, that's why we invited, Mr. Bello, who should say it. County Executive Bello, excuse me, to come to talk with us, to answer those kinds of questions, I think, right? Because that's certainly health related and certainly relates to what we're doing, and he was not unable to come today, but.
Correct, I have not heard from his assistant.
Yeah, so we'll follow up and see, what date he can come, because we've got, 6 months of dates, right, so, yeah. Good one. So we could, I mean, it'd be great to hear his perspective.
And our main goal is not to duplicate, so if
Yeah.
people in the community are doing something, we're not gonna be duplicating at all.
I think that's great, but there's so much going on in our community, I think the governance has put up a lot, like, how do we bring it all together, what's the role of the health department? On all these things, opioids as well, because we, in the community health improvement planning process, we talk about opioids being such a problem, but there's already 16 groups doing it, and so do we add another group? That doesn't make sense. Jerome Child Health is leaning that direction now as well, with 4 or 5 different community coalitions, and how do we all help each other move the needle instead of just doing work, right?
It sounds like, I mean, cure violence is like a sort of public health way of working on gun violence. So it's like, it comes out with a specific mode or strategy.
Typical way that they
Understand.
deploy their.
Yeah, but it's like more of a health version than pulling guns or whatever it is, yeah. Other questions for our commissioner? I'm excited for your deputy.
Yeah.
I'm trying to think who, there's only the eligible people in our community are like 5, so I'm glad you grabbed one of them.
Well, it's actually
That's good.
from outside our.
Oh,
Yeah.
excellent, yeah, that's really good.
Oh, it
That's a
looks
great
like there's
question.
something,
Oh, I think it was just something from, Celia's Otter AI
okay, oh,
thing that
okay.
she had run out of time.
Got it.
That's a great point, thank you. I don't know if they can, I think we're not
No.
receiving input from,
No, no one can comment on.
yeah,
Something came up, but
the zooming is interesting, hard to get used to. Who's back, oh, that's great. All right, thank you. Stuff happening, really great, I'm excited to have an executive assistant as well.
Yes.
You to have, I wish I had, but you to have. Okay, so we're at the president's report, couple of questions, can you just bring the chair over here? Thanks, man. Already had my snacks, but help yourself. Erin has graciously agreed to share a little bit about what she's doing at the schools. But I wanted to cover a little bit of business before we have our group conversation, part. I was checked on the Board of Health websites today just to, start talking about membership. So, it looks great. It was easy to find where the Board of Health is. All the members are listed, including our new members are on there, which is awesome. A really nice description of what the board does per our last nominations team. We now have a new nominations team. Sarah Fletcher and Aaron Grotman agreed to be on that team. We'd love it if one more person could join, so if you're feeling so inclined, it's a very small, 6-month commitment or so to consider nominations for our open position towards the end of the year. So we've got plenty of time for that group to get together and talk. So one more person would be amazing on that team.
So,
Yes. What did I sign up for?
sort of, so you said that by the end of the year, general plan,
So
I
there's,
like deadlines.
yes, thank you. There's one person that needs to be replaced and I can't remember who it is.
By the end of the calendar year?
Yes, her term expires 8/31/21. And so ideally, it would be nice.
25.
Yeah, not 21.
Back in time. That'd be kind of fun.
Finally COVID again, there we go.
Relax.
I'm here. 8/31. Ideally, it would be awesome to have the board already approve, the commissions already approve this person to start when Beth is to step down. In order for that to happen, we would have to have the nomination from this group, probably June, I'd say, June. So if we want to have a finalized nomination in June, then we want to bring some names in.
And I'm an at-large.
Yes. And the last nomination committee talked about how great it would be to have kind of a rolling list of nominations. So, we still have Shaza that was nominated last time. She can be added to your list. I don't know if she's still interested, but she's there. And in the vein of having a rotating list, we talked about having on that board page, on the website that has the board members, just one line that says, if you're interested in being a board member, click here, and Megan, I see you nodding, however, whoever that should go to, I don't know if it's the executive person or just submit your resume or what that looks like. But then we can kind of start getting a little bit of an idea of folks who might be interested. When we had the discussion, when our last two candidates were appointed, voted on, there were some interesting points, which I agree with, on how we get our interest. So, oh, I really like Bob, so obviously Bob should be on the board. Well, that's kind of not the best way, I think, although we're a diverse group and so we all bring different perspectives. If there was a more objective way to do that, it'd be great. I don't know what that way is, other than if you know people, but yeah.
Did we do a press release calling for interest or applications?
Great idea,
Yeah.
sure, yeah.
A good way to at least solicit possibilities.
Yeah, at least to have the option, like we made an effort to be objective if nothing else, yeah. Yeah, that's a great idea.
Does the board have an email address?
I think I emailed someone to get here, so.
I don't think the Board of Health itself doesn't have an email. I think Martha or the executive person was the
She was the point
secretary
person,
for
yeah.
this group, so I would imagine if it goes to anybody, go to that person, which right now Megan is stepping in, but soon will be Terry Lynn, Forney. So that,
So to your point about having like if interested in joining.
correct.
I think Perry might have been the person to answer my email. I don't know if that's helpful or not. Perry Wheeler? I could get that wrong. Oh, he's from.
Yeah, he might have told you like exactly where to come.
The operations, yeah, but I just, as a just as a non-member, my experience was like, I went to the website, I said, is this something I could attend? And then I wrote to mchealth@monroecounty.gov, and the person that answered that, I believe, was Perry, who said, yes, you may attend.
Well, it would be great to figure that stuff out.
Right, so you have an outsider
It all goes to
perspective,
a-
just thrown into the mix, maybe that was
so
supposed to go that way, or maybe
MC
it.
Health is the general
Okay.
email address for our Department of Public Health.
That's good.
Fascinating that.
I could go check my email to like double check myself, because sometimes I interface with Perry in the
Yeah.
disabilities realm, so I may have gotten that mixed up, but I remember thinking, oh, cool. Perry did it.
So I'm guessing you don't know where MC Health goes.
No, it goes to, it's its own box that, Martha used to cover, one of the other secretaries and.
So could we have like resumes and cover letters go to that?
We could,
Yeah.
absolutely. And that would be great to have sort of a rolling thing and then maybe a response, thank you for submitting, we're not hiring right now, but we will be shortly. Hiring's not the right word, but yeah. So then we've got some just objective way of collecting.
So can we, is that possible to add that to the website?
I think Megan's got it in her minutes. Okay.
So I think the other thing is if there are gaps that we're looking to be filled, maybe we should put that on the website to say, these are the areas where we really like, representation that we're missing.
Yeah, in our at large.
Yeah, and then I think bringing us within this group, identifying those gaps, like, they had said in that government meeting, that we were missing representation from veterans. We know we do have somebody, but there's not, I don't know, we want more. So those are things that I think we should identify, and then maybe all,
And we
We
can.
Oh,
no, you're okay. Did you have a question?
What areas would we like represented?
That's a great question. I mean, we particularly we're looking for psych and mental health because we know that it's a problem in our community right now. Veterans and the elderly, which I take offense to that. We are elderly is represented here. So those were suggestions for sure that came from the commission.
I have someone who is interested. She's the chief nursing officer at the cancer center. So, and I don't know if we want cancer to be a someone who has that knowledge or background. But so I can have her apply through the.
Sure, yeah. And we also, and this is nothing against your person, we wanna make sure we have non-health representatives here, which there's a lot of us right now that are health related. Which it's Board of Health, so that makes sense, but we should also get a lay perspective.
Yep.
Any other characteristics pop out to you all?
And I think the last two people that went off were non-health related.
They were,
Is that
that's why I'm saying that,
Absolutely.
yeah, it was so nice to have that perspective.
I agree.
I mean, we all gravitate to people that are like us, right, and we don't need a board of, well, same people, living in the same. I would. All right, great. Anybody wanna join our two lovelies?
My brain's working slowly. I don't know if it's something you could put on the website, but it may be useful and interesting to have a young adult,
Yeah.
right? I mean, a lot of what we're,
Yeah.
person rather than.
I like that.
So Shayza would probably fit that
Who?
demographic. Shazia.
She is, young.
Yeah.
She was a student too, correct?
She's in AmeriCorps and also a student, I believe.
But she said at Potsdam. Cause I remember questioning that.
Like, where's Potsdam?
Well, I know where Potsdam are, I went there.
Oh,
for a while.
okay.
One of
Yeah,
my degrees.
she's probably part-time. She's a young mom and also AmeriCorps and also, she's working here at Christian was partnership, or at least was, yeah. All right, great. Well, we'll add that to the website. We definitely will do a press release. I think that's a great idea. And perhaps, our nominations committee can craft that press release or at least the ideas, and it would be looking just like the website, and Megan would be the one to work on that with you since she's the communications person. I also, I also wondered in the vein of, future topics. So, Megan and I will continue to maybe get a date for, executive fellow, just to have something in the, over the year, it doesn't matter. But then also getting the Race Commission back here. And then I had Steve Newcomb from the County, Office for Aging. Are there departments within the Department of Public Health Department that we want to hear from? And one person that came up with Roxana to continue our conversation on early, childhood development. And then there's probably couple other community people we would invite, and you have a stake in that as well. Are there other health department folks that, Mari, either you think would be important for us to hear from, or that we would like to hear?
All of my divisions are doing interesting work. Roxana would cover early intervention and preschool special education. Certainly Kathy Fairlock has come and discussed the different clinics that we have, immunization clinic, tuberculosis, our sexual health clinic. She can talk about some of the outreach work that we do to get folks tested, some of the contact tracing that we do when someone comes in and is positive for whatever, and our team does those interviews to invite those contacts to come in and be tested in a HIPAA compliant way. Kate Linus could talk about NFP and Starlight and WIC, who's the head of our maternal child health division. I'd say it's always fun to hear about public health preparedness. This is the division where the grants were pulled out of the federal budget in a way that makes it very concerning that they might not be added in or approved whenever their next meeting is. STAR, you all know from environmental health division too, but environmental health division does so much other work around around inspections of pools and septic systems, and migrant camps, and children's camps, and rabies, and restaurants, which knows us quite. The water, the lake, the water source, drinking water sources as well.
And we talked about in the past having the person that's presenting ask for advice. So is anybody working on a problem or trying, I mean, the funding issue certainly becomes problematic, but anything that we could advise or help with would probably rise to the top. I mean, obviously everyone's running their own division, not waiting for input from us, but if there's.
Yeah, I would say we might wanna think about the maternal child health, given some of the things that we're gonna be putting out some RFPs, but have to not talk about specific things within certain windows of time for given purposes. But that might, I think that would be a reasonable place to start, the maternal child health.
Interesting to me. That's good with that.
Suggestion too, given the focus of the administration on two issues we were talking about earlier, the gun violence and opioids, that maybe we have like a semi or biannual update on those things, just because there'd probably be a lot more moving parts and a lot more opportunity to provide input into those.
So his team is always coming up with new ways to try to address the opioids, so that's always interesting.
Well, and if we're going to dig into the cure violence next time, is there a person that we could have talk that would be related to that in some way?
We'll check with our consultant, because they could certainly come and present their own kind of take on the assessment.
Yeah. And kind of make it a full conversation of the.
Would we be interested in ever having any like community-based organizations?
Absolutely, yeah.
So I was at the Festival of Inclusion this weekend, and there was a group that provides like trauma-informed care to members of our community. They do a lot surrounding like after an event, coming into your home and helping you navigate that. I gotta get their, I brought their card home with me, but I can send it to you, and see, and like the services they seem to get provided for me.
Was it not by their cars or?
I've met so many people, but like, I was like,
Yeah.
that's a really good one. I'll let the-
I was gonna say, yeah. Those my people? Right.
I'll find out. I have the card.
Cause there's also a fit in the pick teams
Right,
that
she was
respond
saying.
when
Yeah.
he's out there.
Okay, all right. Yeah, it was at Nazareth. And then, I'm a clinical director for the Special Olympics, so I ran all the health promotion stuff that was going on, among my like 8,000 other jobs. I do that too. So, but that was, it was a really great event. So many community organizations coming together. So it was amazing to see all of the organizations that we have for disabilities in our community. Really nice. But they're all separate, you know?
Correct.
That's where some of the problems are.
But the Special Olympics are coming here to Rochester the next 2 weeks, right? Cause it was last weekend.
Yeah, so last weekend was the big Winter Games. That was at the Riverside Convention Center. And then, that was 2 weeks ago. And then this last weekend was Festival of Inclusion, so Special Olympics. International was there, and we hosted events at that event.
So the snowshoeing is at the Rochester Sports Complex, right?
There was stuff all over. There was Henrietta Town Center.
I
had
sure
the
about
gymnastics.
snowshoeing.
Got it, got it.
Our sides, yeah.
I was at the convention center. That's right.
I didn't realize it was so
It was-
big.
yeah.
I didn't realize.
I think there's some athletes in Italy right now too.
Yeah.
Wow.
That's really cool. Right. Sorry, one of the things that I've been curious about, maybe it's just on my longevity committee, is for the Atupa stuff, I know we see a very small percentage of the ones that come through.
Yeah.
I was wondering if they'd be willing to just come and talk to us about like the trends that they're seeing and like how that's going, like more broadly with, as we continue to see more and more youth engaging in, pulling nicotine in new and in creative ways. And,
Yeah.
I'm just curious if like, that would be something that we could talk about. Maybe the next time we've got one in front of us, we may put that into it or something like
Yeah,
that.
sure.
If folks would be interested.
It would, because we do just see the cream of the crop, shall we say, on the Atupa, but all the rest, what are they seeing day to day? What's going on? Yeah. And we did have a little bit of conversation around that from Star.
Yeah.
And but it should be before the cases, where she was talking about, what you can sell or can't sell in convenience stores and flavored vaping and how they look for that and all of these, yeah.
I saw in the news, I was just thinking about it, that the health department had had to shut down the Texas Roadhouse. Does that?
Right?
No. So that is every restaurant, every push cart, every stall at a festival, they need to get a permit from us. And so we go out and inspect and we can say, oh, you are not meeting this list of New York State or Monroe County sanitary codes.
Yeah.
And if there's a critical enough violation, we can say, look, this is not safe for you to cook anymore, it's like placard at the front door, and they can't serve until they remediate whatever it is. So
Okay.
it's not necessarily that we shut them down completely, but you may not serve food until you have addressed this health concern. And then they can reopen, or they can say, I'm not interested in reopening anymore, that is a proprietor owner decision. We just say you have to meet this standard of meeting the sanitary code and not putting the public's health at risk.
Which they didn't prepare.
Well, I was just thinking of like a couple of years ago, there was that pool incident at the hotel that I think our Board of Health had like a piece and looking at.
Because they also inspect water, I mean,
Yeah.
maybe environmental health, I'll put that on the list of things.
Yeah.
Because they do run all the restaurants, all the water, all the, so it's a
And the goal is never to shut people down. The goal is to go and see, how can we educate? How can we balance the individual right to make money doing whatever you're doing and not put other folks at risk of getting sick from foodborne illness or waterborne infectious thing if you're not filtering your, cleaning your pool well enough.
All right, other thoughts before we dig into school health? Yeah, school health. This is in the vein of learning about what each other does. Capitalize on the expertise in the room for sure.
So what you're getting is a district profile, talks about our schools, our funding, superintendent. So currently we have 48 preschool sites. We oversee 39 total schools, 5 alternate programs. Our enrollment is at 22,700 students. And just to put that into perspective,
A lot of students.
it used to be when I started, when I paid myself 2004, 36,000.
Oh my God,
Yeah.
wow.
So, charter schools though, we have 21 charter schools, 8,500 students going to charters. So, the number of charters has increased. In the past. Private parochial schools, we have 4. We provide nursing services through Monroe and BOCES. They hold a contract to provide services to all of the schools within the city limits. So all the charters, all the private parochial, and all the public schools. It's about 70 sites we cover. And we have 25 RNs currently. We are working to more. We used to have about around 20. And we're having a lot of trouble finding them. So our we have more LPNs than we used to, which is not probably like 35 LPNs, 45 school health aides. So the allocation is based on the need at the building level. But we have to have an RN assigned to each school. So some school nurses are overseeing that. So it's kind of.
For those who may not know, that's a scope of practice issue, so an LPN can only do so much, and some, things have to be done by her. I don't know all the details,
Yeah,
but
so
that's
lots
why
of phone
that's a
calls between schools, these RNs are responsible for a lot, and there's a lot of things that the RN can only do, a lot of assessments for special ed, putting in orders, some kids can't be self-directed, which means they're not allowed to take medication without the presence of an LPN or an RN, so we can't just swap them in the school in a lot of our sites.
So how, say again, how many nurses?
25 RNs.
And then
35 LPNs and 45 school.
how many RNs do you?
So our school, we've definitely decreased the number of schools based on our enrollment, so that has happened over the past couple of years. We've seen the school closures, migrations, so probably about 32, 33 would be where we would like to be. And we've been working with BOCES to try to have them be a little compatible. But of course they have to stand in the way, those things.
Explain the whole BOCES thing. So, yeah, it's not a superintendent, right, situation, but what is BOCES?
So Monroe and BOCES hold the contract and they provide all the staff for us for school health services.
The BOCES model is that things, in my understanding of it at
Yeah.
least,
Oh,
is
there's a lot
that
of
things that schools use that they just need a little of,
Yeah.
in theory, at least, it consolidates those services so that districts can use occupational therapists, for example, or primary project as a program, but not have to put the whole bill themselves, because they can share with other schools. At least that's where it makes
So
sense.
that's more utilized in the rural schools where they have less of the need.
Yeah.
In our district, we kind of hire our own people, but for the school health services, when that county filled out, BOCES, second.
So what is the school health aid? Is that like a certification?
They're just, training for students.
So,
Yeah, they do a lot of our clerical work. They do a lot, under the direction of.
other duties as assigned,
Yeah.
whatever fire needs to be put out at the moment.
Yeah, they do, screenings, any failures have to be rechecked by the department, so things like that, clerical work. Which there's a lot of trying to physicals, calls to parents, and all of that. So, and they're very helpful because they have more time.
Yeah.
There are Spanish speaking population usually. Communicate and help.
So is that like is that like a title or is that a certification? Or is it a title?
It's the education level.
Just. Yeah, so now I'm excited. Program, so I really, my goal is to increase access to services for our kids. And decrease some of the disparities they see into the obstacles they face in services. So we have 8 Article 28 school-based health centers that reside inside of our school. They only serve the students who are enrolled in the schools where the student resides, and that's only by parent consent for services.
So
Unless it's
Article 28 is
reproductive.
like a regular primary care,
Full on.
like clinic,
Yeah.
healthcare, you know,
Yeah.
hospitals fall under 28.
Hospitals are-
Hospital,
Zoning mean that you have 8.
Yeah.
Okay, awesome. I mean,
Yeah.
wow.
It's great. So they cover routine medical care, reproductive care. Kids can be seen for reproductive care if they're over 12 without consent parent. They do mental health counseling. They do referrals for mental health counseling. They can do chronic disease management. And they're not replacing their primary care. They're just a complement of it. So they're communicating any care they're giving back to the student primary care. No out-of-pocket cost to students, so even students who are uninsured, they have consolidated enrollers, so they can get them insured, and they have grant funds to bridge that gap. So those partners are URMC, School of Nursing, Rochester Regional Health, and Anthony Jordan. Those centers are 2 elementary schools, School 9 and School 33. And at our secondary school, East Edison, Padilla, which is the Franklin campus. Thurgood Marshall, which is the Charlotte campus, and then Freddie Thomas Middle School. We just did ribbon cutting on Friday for Monroe. It's super exciting, yeah.
And they can serve the kid, and then I know there was a debate about the family of the kid. It's
Yeah.
just the kid.
It's just some of the mental health are they call it family, but it's also- mental health clinic. So through a grant for OMH post-COVID, we have been able to enact 11 new mental health schools. So we are up to 13 licensed mental health clinics. They're providing tier 3 support to students who are referred by a school staff member, usually a social worker, and then those services are billed to the
tier
student
1
for
is
sure.
stuff we do for everyone, tier 2 is a little bit of extra.
Yeah, and tier 3 is
Tier
a
three
real
is-
needy.
Individually tailored.
Yeah, thank you.
How, I'm curious, like with the, like the physical co-location, all that is great. How is there the navigation between the FERPA and the HIPAA and the, like, what are they allowed to coordinate and talk with between the school and the school-based building?
Yeah, so they have the parents sign
Okay,
a HIPAA form.
so,
We're under FERPA, so there is some information shared, but not a lot.
okay,
We know who you're seeing,
okay,
basically, and that they're being
That's-
seen for whatever you're doing now.
so it's a referral and
Yeah.
then they're on, okay, got it,
Yeah.
okay.
A lot of the agencies will sit in on meetings that the schools hold in to see how they can help, and how they can help. So yeah, they're meeting the needs of a lot of kids who have been referred in the community, but weren't being seen.
There's no providers.
Yeah, that
That's
too.
great, yeah.
That too. So we're planning to open 5 more next school year.
Wow.
Yeah. That will include covering all middle and high school, so we'll have some kind of tier 3 mental health support in our.
So who are the providers of these places?
Yep, so the providers are Liberty Resources, Villa of Hope, University of Rochester, and Rochester Regional. A lot of smaller school districts have one. We and really try to spread them out through the community, and that's what we're seeing. And we do have a consortium group that convenes, that we worked on shared language, common referral process across the school, so it made it easier for parents and staff.
Are you guys involved? Like, I'm like, do you do, I assume yes. I assume so.
We're absolutely involved, so, even though the money came from OMH grant, that really was for startup funds. What sustains it is the ability to collect insurance.
Yeah.
And, all of the providers have to get a letter of support from my office. And in there, we always tell the providers that you need to, because at one point, it was off balance, and most of our counseling services was in the suburban area. And not enough was in the city of Rochester. So we actually pulled data from New York State Department of Education and told providers, this is unacceptable. We're no longer going to be, giving you letters of support if you do not start going into the city, figure out what you need to do to get the agreement to go in. So we continue to oversee what's going on. So if there's any issues, the thing about school-based counseling is that it can work with family members.
Yeah.
And family members could be connected to their main campus because all of the programs are satellites. So the main programs is within where Liberty Resources is, but they bring the satellite in. So that means if a child needs psychotropic medication, they would be able to have access to that doctor. So it really is good, it's helpful for the school. There are the HIPAA and the 42 CFR, substance use that is a barrier at times. And the therapists try to get consent forms, as you mentioned, to try to give the school some information. But the schools have been very understanding of the limitations of the licensed clinicians' inability to give certain details. But all safety concerns, they always bring it to the attention to.
I love that balance, because we talked about that with the special needs kids getting screened, and doesn't seem like there's that same no.
Yeah.
Have to serve everyone,
Right.
yeah.
And the good thing too is that they have access to the on-call service too. So if it's a weekend and they need that therapist or they need on-call services, they can reach out to Strong and say, I need some help and support as well. So when school is over, they still have access. Can you tell me what's been happening with, or do you know any information? I know at one point there was ARPA dollars that I think the city of Rochester used to be able to have more telehealth services provided for you. Oh, you are, okay, let me stop. Okay.
Everybody's like jumping with questions,
It's
it's great.
exciting.
Okay,
I love hearing
I'll go
this.
there next. So, all schools have access to telehealth, and that's a program that's been going on for at least 20 years. I remember it started with this huge machine that was in nurse's office.
Right.
And we could only put it in the offices that have room, and it took up a lot of room. It was pretty crazy. But this program has been going on through the University of Rochester, and they have technicians who come out to any school that calls them and can do a visit. Also very active at preschools, and parents who know about it utilize them quite a bit, because it is helpful for them to be able to stay in school, see the student where they are, and have that connection with the physician. So the funding that you're discussing, the ARPA funding, has supported having equipment in the schools and training of the school nurses. And we're really trying to expand to get away from just SCUBAR doctors and have the student paired with their doctor. So most of our kids are seen by UFR or Rochester Regional. We're trying to expand that in that way. So 20 schools.
Yes, yeah, they could. Yeah, you're right.
So 20 schools currently have nursing staff trained clinicians. So super exciting. We've really been careful in how we rolled out this program because we didn't want to just throw equipment at them and say, it is your job now, because but a lot of the nurses have been very thankful because a lot of kids we see come down for earache, and we're seeing them day after day, and this is something that the nurse can actually do. So it's been very helpful, and they really embraced it. We still have the ability to have the technician come out, and the schools that don't have the equipment are still utilizing the program now. So our goal is by the end of next year to have every single school, and I know they're working on charters to have the equipment.
So you can't have an LPN or a school health aide initiate those kinds of,
They can,
they can, okay,
Yeah.
gotcha.
yeah,
That's-
we've done less training
yeah.
in school health, there's not many schools that just have a school health
Okay.
aide. And if they do, it's like maybe for an afternoon, it's not like, it's because of an absence. So, yeah, there are RN or LPN.
Okay.
There are some things they do that we still utilize the text for, like the strep swab, flushing of the ears.
That's fine.
Yeah. They've really helped with kind of making that connection, if there's physical we need. There's a student who may have asthma medication in school, trying to get that in school by utilizing that. Eastman Dental, so Smile Mobile. Smile Mobile has been going on for, I want to say over 50 years, and I've been it. We have 8 schools now that have a visit from the Smile Mobile, and environmental cleaning, skilling, sealants to consenting students. The mobile park outside the school, they have to have a toilet and water. We also have another grant program for Eastman Dental, called the BUDS program, building dental homes in school. And that's in 7 schools. They set up a portable chair, they get access to a sink, and they can do cleaning, sealants, and make referrals for any needs. Long partnership. Plum assists our nurses in vision screening. They've done that for the past 3 years. They used to have a Vision Care for Kids program that would happen on Saturdays, and unfortunately, there's just too many barriers or so many space it wasn't being utilized. So I believe they have grant funds to actually have the vision van, which is coming down the road. Exciting. And we do have an agreement in the works that would allow, after they do the screening, any students who have failed, an ophthalmologist would come in and do an exam. And provide the students with those 3 classes, but they would have got like the Saturday program.
So what I love about the Plum partnership, and correct me if I'm wrong, is not only can they get screened in the classes, but some of the high school kids are learning how to make glasses to help.
East Side.
Yeah,
That's the East
at
Side.
East High.
Mhm.
So the
You guys
kids
are
are
getting
learning
ahead of me.
optometry and circling back, so good.
Yes, so East High has a New York State an accredited career and technology education program that teaches students the skills of a trained optician. The 2-year program, they learn to fit glasses, make measurements, make the lenses, and put them together with brain. Students who complete the program are eligible for a career and technician education credit and endorsement towards a degree in ophthalmology dispensing from Erie Community College. So we utilize that program probably more than Plum with students in need from schools. They're referred by the school nurses, and then we have an ophthalmologist come maybe 4 or 5 times a year. We bus kids to East. We get a prescription from the ophthalmologist, and then the students pick it up. Yes.
Yeah,
It's a really great program.
I wonder if they should do something like that with dental as well, to train
Yeah.
hygienists and train, yeah.
Let's see, each is a program that also came out of COVID through ARPA funding through URMC. It stands for Enhanced Access and Connection to Healthcare for each youth in our CSD. And they support a program called ECHO, which is an extension of community healthcare outcomes. It's a telementoring model. By the end of this school year, all schools will have had the opportunity to take part in a 9-month series. Each month, there's a remote hour-long session that includes a didactic session about various mental and behavioral health related topics. There's a case presentation from the school. They talk about identify a challenging student, and then providers and other school support can assist with ideas and resources and make them connections. So that has been really successful in kind of making connections with outside providers, and having the school kind of empowered to reach out.
That's all you do?
I mean, we do the routine
Come on.
immunizations and all those things, but they're not fun to talk about.
Wait, you do immunizations as well?
Well, we don't do immunizations, but we track them,
Yeah.
which is a huge deal.
Yeah.
Our systems don't sync with NYSIS, so we input all of them in our own system ourselves. Which there are some, yeah, there is some push. I know letters are being written to the state to get them to, but the way NICES works is if you don't put information into it, they won't share it with you. So you don't give immunizations, so they won't share.
Trillium
That's a
and same-
huge,
same
and then
problem.
school health thing, you know, that's a lot of,
Yeah.
it's a huge task.
Regulatory.
All of our students in certain grades need physicals, all new entrants need physicals, we have a nurse practitioner who works 3 days a week who fills the gap in the kids that don't have physicals, especially when it's needed for a work permit, sports,
Yeah.
or CSE, which is special ed. It's about 5 years ago, we kind of changed the way we got physicals. We have them now all come to one fax, and we share that fax with all providers, and then it's farmed out to the schools, because we just weren't getting that. So that has really increased the work.
So if we have youth that are signing up for SUE, they need a work permit, and you're saying they can get a physical for that? And so what do? They just contact their.
Yeah, so they have to notify the school nurse and then she will. Yep. I know that's an issue. Some of the city folks on that. I think it's hard just to make the connection of which kids need it and, you know, letting them know that. It's like, that's tough. Because they always get a lot. Same reports.
Yeah.
Meeting, very last minute.
That's what I do as
Yeah.
a suburban,
Yeah,
wealthy mom,
Yeah.
but yeah.
so
And I
that's tough.
definitely am air quoting wealthy, but you know,
Yeah.
you've got your stuff together and it's still, it's
Every
a hard
student
thing.
who signs up for it, and they're just trying out. And it needs to be.
It's a summer youth employment program.
Oh.
Yeah, so the city opens it up for city residents and we work with Shore Works for non-city residents. So it's like just a work opportunity for our youth.
It's been my funky thing. I joined a church group and there's nothing these ladies have to do,
Wow.
but all day long, I cannot turn it off and I cannot get off of it. This is, you live in church for sure. Sorry about that. So your title, like, clear me, like, are you all of health for all the schools?
Student health, staff.
Yeah. And that's different than, what was that guy's name that used to run like the you know, the policies
Carlos.
around, yes, thank you.
Carlos was over physical education and health education.
Okay,
The gym
gotcha.
teachers
Yep.
and sports.
Yeah, that is different, yeah.
He's not too, he's not here. but-
Yeah, 2 people have taken over.
Yeah.
Well, that's amazing. Where does the screening, you do that too, the early intervention
Yeah.
screening stuff?
We do vision and hearing screening, so that's in certain grades, that's with all pre-K and K, which we have a team. And those are district employees, and they do all the CBOs and all the district schools.
Which is not the same as with the nurses and the.
The nurses are doing the higher grades, so 1, 3, 5, 7, and 11 require vision and hearing.
But the big brunt of the younger kids.
Little kids, yeah, we need a little more time.
So you're responsible for the health of the charter school students as well that are in the city?
Will you be administering the youth first behavior strategy?
That is a good question about charter. I don't know, I think who was in the position prior. And I think she definitely was on top of that.
Are we the intern epidemiologist, or who is epidemiology?
So Heather Essick is still the supervisor of the epidemiology and disease control unit.
Yeah,
And so James Hiltunen
yeah.
is now, has taken over a number of Anne's responsibilities and then
He's not an
one of them-
epidemiologist.
I'm sorry?
He's not an epidemiologist. Both guys that.
I don't think
He's not.
she was awesome, but she
Yeah.
gained a lot of that experience on.
Long time ago.
Yeah.
Yeah.
And, you're in this,
You're right, yes.
and so it's the 3 of them.
And we now have a data analyst, Sarah Bird, dedicated to opioids. We have Madeline, I can't remember her last name, dedicated, she's an analyst for the violence work.
Great.
And then we still have our public health nurses or LPNs to do outreach about cases of reportable diseases, pertussis, not measles yet, but they had to, rabies, all that stuff.
So who's in charge of implementing the behavior now?
So that's
Yeah, James.
Heather and Yuri coaching James.
The work.
Yeah. Stuff else
Yeah.
that happening.
Well,
There's a lot more connection to providers. There's a lot of lots of. As long as
Yeah.
I think it's.
I was gonna say what's like your next big thing, but it is just expanding all these existing programs that are working so well. Great. Who wants to be next on the sharing block when we don't have a speaker?
Sure, no, I really when I first started on the board, but
Yeah,
I
no.
jumped again, sure.
I mean, anybody, obviously. Know what's going on in the bureau, I think we have you as well. You gave them 5 minutes, maybe. I still don't know what you do, and we work together all the time. I know about 6 things that you do, I don't know which is the main thing.
They're all the main thing.
Yeah.
That's the problem.
A lot, I'm sure. All right, well, thank you, is, motion to adjourn the meeting, anybody? Anybody else? Don't you have an event coming up? Do you wanna tell us about that?
A million events, so which one?